Hi, Dr. Bo here. I'm a cataract and refractive eye surgeon. In today's video, I'm going to be going over and giving you my initial thoughts on a new, highly anticipated cataract lens implant lens, and that's the Johnson & Johnson PureSee IOL. This lens was already available in Europe and in Asia, but recently got approved for use in the US. And so we'll go ahead and take a look at the website, go over and see what the lens is all about, and then I'll give you some of my thoughts about where I see this lens being useful and where it might fall short a little bit, okay? It's a extended depth of focus lens, and so previously Johnson & Johnson had the Symphony IOL as their extended depth of focus lens. But the main drawback for the Symphony was that it is a diffractive lens, meaning that it uses diffractive rings to provide the increased range of vision. Now, if you're familiar with multifocal lenses like the Johnson & Johnson Odyssey or Alcon's Panoptic lens, these are multifocal lenses that use diffractive rings to increase their range of vision, but the drawback is that there is increased risk for side effects like halos and glare because of how the diffractive rings work. The Symphony lens also had this issue, and so Alcon came out with the Vivity lens as their non-diffractive extended depth of focus lens, which provided great distance vision, intermediate vision, and then also provided some near vision. However, because there were no diffractive rings, it minimized the risk for side effects like the glare and the halos. And so Johnson & Johnson now has released the PureSee as what I think is a direct competitor to the Vivity lens, to be in that same space where it's a extended depth of focus lens, meaning that it will give you increased range in vision, so great distance vision. It will give you intermediate vision and then also some functional near vision while minimizing the risk for side effects like the glare and the halos. And so I see this being a very highly successful lens, and I'm sure a lot of patients will do very well with it. So let's go ahead and take a look at the website. This is on Johnson & Johnson directly. I'm going to kind of briefly go over it and just highlight some of the key points that I think are maybe a little bit more interesting and more important for you as a patient to kind of understand. Here you can see that it has key features: monofocal-like visual disturbance profile, excellent contrast, great range in vision, and then also tolerance to refractive error. They're reporting that 90% of patients occasionally or never wore glasses after getting this lens. 97% of patients would recommend the lens to friends or relatives. And then 97% of patients report no very bothersome visual disturbances. So this is the first table that I was looking at, and I think it's important to take a kind of a detailed look at it. This is reporting excellent distance and intermediate vision with some near. The TECNIS PureSee delivers monofocal-like distance visual acuity. And so in this table, basically they are comparing their two primary lenses here. They're comparing the PureSee lens to their TECNIS Monofocal lens. And so the gray line is the TECNIS Monofocal, and then the blue line represents the performance for the TECNIS PureSee IOL. Now, here you want to take a look at three main working distances. At 0 diopters, you have the distance vision, which is far range vision. At 26 inches, which is 1.5 diopters, you have your intermediate vision. So this is more so for working on the computer or things that are just a little bit beyond arm's length away. And then lastly, at 2.5 diopters, which is 16 inches away, you have your near vision. And so of course this is things like reading your phone, reading a book. And so when we look at these two in comparison, I think the most important takeaway for this table is that at distance vision, you can see that they're both pretty comparable. Both offering, or at least what they're saying is both offer potentially better than 20/20 vision. Of course, you can see that with the TECNIS Monofocal, it looks like it's slightly sharper overall than the TECNIS PureSee, but not by much. The gap widens when you go to the intermediate and near range vision. You can see here that with the PureSee, both at intermediate and near, you're getting about 1.5 lines better in terms of visual acuity. So here they're reporting at the intermediate range about somewhere between 20/25 and 20/32 vision. And then with the TECNIS Monofocal, you'd be closer to 20/40 vision. And then same thing for the near range vision with the TECNIS PureSee. Looks like you're between 20/40 and 20/50 vision. And then with the TECNIS Monofocal lens, you'll be closer to 20/63 vision. And so, kind of general takeaway is that, yes, both of them are comparable at distance, but the TECNIS PureSee seems to be performing much better for the intermediate and near range vision. Moving on to the next table here, this is the first and only EDOF IOL in the US without a warning on loss of contrast sensitivity. And so this is also another important consideration you're thinking about this lens, is that with the extended depth of focus lenses and also with multifocal lenses, you are going to get some loss of contrast sensitivity. And so they're saying that with the PureSee, they don't have the warning. It doesn't mean that there isn't a loss of contrast sensitivity, but maybe they haven't met the requirements or threshold where they're required to make that distinction. Contrast sensitivity is important for your overall vision quality, especially when you're reading. You want to be able to make that distinction between the letters and then also, kind of the background. So you have poor contrast sensitivity, you can get an overall degradation in terms of how you perceive things. Looking at this table on the left, contrast sensitivity, again, they're comparing the TECNIS PureSee to just a monofocal lens. You can see that overall, it seems that for the most part, very comparable. Slightly worse contrast sensitivity with the TECNIS PureSee, but it may not be clinically significant, meaning that it's such a small amount that you may not be able to perceive it. And then this table on the right, they are saying that the TECNIS PureSee maybe has less contrast sensitivity than the TECNIS Monofocal, but it is very comparable to their competitors, the Clareon Monofocal and the Clareon Vivity, which are both made by Alcon. Now, of course, we always have to take a look at these tables and take them with a grain of salt. Obviously, this is made and published by Johnson & Johnson, so there may be some biases when they are reporting these results. But the general takeaway is that they're arguing that the TECNIS PureSee should offer great contrast sensitivity, very comparable to their competitors. Next, the purely refractive design enables a monofocal-like dysphotopsia. So what this is showing us or trying to illustrate is that with multifocals especially, you can get halos and glare around lights. And so with the monofocal lenses, we really don't get much of it, minimal at least. And so, the ideal lens should be, more comparable to a monofocal lens, which is what they are proposing that the PureSee lens does. You can see here on the left, this is what the lights may look like with a TECNIS Monofocal. You can see that there's very little glare, very little haloing around the lights. And then on the right side here is the TECNIS PureSee, showing something quite similar. And then I think this is the last table, tolerance to refractive error providing pure ease of mind. So this table here, they're again directly comparing their TECNIS Monofocal lens to the TECNIS PureSee in the blue. Here at the bottom, 0.5 diopters of myopia. So here they're saying that after cataract surgery, if there were residual myopia meaning nearsightedness, so if you were a little bit nearsighted even after your cataract surgery with this lens, a large majority, more than 90%, would still be able to achieve 20/25 or better vision still. Same thing with the hyperopia, 0.5 diopters of hyperopia, still over 90% of patients achieve 20/25 vision or better. And then in the last column here, this is comparing if you have 0.75 diopters of astigmatism, still great results. Here's their overall reported number, 96.8%, with amblyopia achieved 20/25 vision or better binocular uncorrected. And so the important takeaway for this table is that for patients who may not get perfectly plano, meaning that there's no residual refractive error, you can still have great vision. And so this is important for patients who maybe have had prior ocular surgery. So for example, if you are a patient that has had LASIK or other refractive procedures like RK, then sometimes when we do cataract surgery, the results are a little bit less predictable because of your prior ocular surgery. And you may end up with a refractive surprise, meaning that, despite, all the calculations we do and the surgery goes perfectly fine, you still might end up a little bit nearsighted, or you might end up a little bit farsighted. And so what Johnson & Johnson is proposing is that with the PureSee, even if you are a little bit nearsighted or a little bit farsighted, or if you just have a little bit of astigmatism even after cataract surgery or after your cataract surgery, then you still will likely have 20/25 vision or better. And so that's actually kind of one of the strengths of these type of lenses, the extended depth of focus lenses, is that they're much more forgiving. If you had prior LASIK or prior RK, you might not be a great candidate for a multifocal lens like the Johnson & Johnson Odyssey or the Alcon PanOptix, because they are a little bit less forgiving in that sense. Next, I do want to take a look, jump over to the Johnson & Johnson Vision Simulator. Here you can play around with the different lenses. I have a video which I'll link up on the screen where you can take a look. I do walk through how to use this, but basically you can play around with the different lenses and see which one offers the type of vision that you're looking for. I'm not going to go into too much detail about how to use it since I have it in the other video, but I'm going to go ahead and pull up. We'll go to, I think we can do the dining situation here. And then let's go ahead and change this to the TECNIS PureSee. Okay, great. So let's pause that. So here we're basically in the dining environment, and the point is that it wants to illustrate what the vision is like with the PureSee. And again, remember, the PureSee is an extended depth of focus lens, meaning that it should offer you great distance vision. It should offer you great intermediate vision, but the near vision, you may struggle a little bit. And so they may use the term functional near vision, meaning that for larger print, you should be fine for the most part, but for very fine print, you still probably will still need reading glasses for that. So let's take a look here. On the screen, you can see that this person is eating out. The distance vision, which is, maybe this, the background with the pictures, the table in the background, they're all very nice and sharp. Their intermediate range would be more like the drinking cup here. Maybe this gentleman here is also closer to the intermediate range. You can see that they're all in nice fine detail. And then the menu, which is considered near vision, all the way up close, you can see that you can still actually read the menu. You can tell what it says, but it has a slight blurriness to it. And so that's really kind of the takeaway with the PureSee lens or any sort of extended depth of focus lens like the Vivity from Alcon, is that up close at near, you should expect to, maybe you can get by with most things, but it may not be completely sharp. You probably will still need reading glasses for that. And so I'm just starting to use the PureSee lens. I'm excited to use it. I think it sounds like a very promising lens. Will it be the perfect lens or best lens of all time? I don't think so. I mean, I think it will have its niche in a place where it fits for the right patient. Where do I see myself using this? Again, going back to the previous points, this is a great lens for someone who maybe is active, if they drive a lot at night, if they are active with sports or other activities, where they need that distance and intermediate vision, but maybe don't necessarily need to rely on their near vision, okay? Other patients that I would consider this for, Like I mentioned earlier, if you had LASIK or other refractive surgeries like RK, I think this will probably be a pretty forgiving lens and will work well in that situation as well. Who would not be a good candidate for this lens? I would say if you really need the near vision, you really want to be able to read without reading glasses at all, I probably would at least give this some extra thought. You might be better off with a true multifocal lens like the Panoptix or the Odyssey lens. Like I mentioned earlier, we're just now starting to use this lens, so it'll probably take me at least a few months before I can give you a stronger opinion on where, how I think this lens performs. But based on what I've seen, I expect it to be a very promising lens. I think it will work very well. And so if it's available to you, and you're interested in it, I think it's definitely worth considering. I think that's pretty much it. I mean, those are kind of my initial thoughts on the lens. I expect this to more or less just be the direct competitor to the Vivity lens by Alcon. And so if you would like to learn more about the Vivity lens by Alcon, I'll have that linked up on the screen as well. If you're considering this lens or if you've already gotten it, please let us know down in the comments. I think this lens will be very interesting to see how it does. Another thing you can also even consider with this lens is that instead of having them both set for distance, you can also consider getting mini monovision. You can have one eye set for distance and the other eye brought in a little bit closer. These lenses can also work well for that. So it'll be interesting to kind of see what other surgeons think and also just the general feedback from patients. I definitely am looking forward to using this lens, and it'll be exciting to see how it does over the next several months and going in towards the end of the year. Thank you again for taking the time to watch. I know that maybe this is not as much information as you would have hoped, but again, I just now getting my hands on this lens, so I'll be able to give you a better detailed answer and opinion about things once I've tried out the lens a little bit more. If you have questions, please drop them down in the comments, or like I mentioned earlier, if you've already had the lens, let us know. I mean, I would love to hear from you guys, especially. If you found this video helpful, please make sure to like and subscribe. And thank you again for taking the time to watch my videos and supporting my content. If there are other lenses you would like to see, also just let me know down in the comments. I can definitely take a look at those as well. And that's pretty much it. If you found this video helpful, check out this video on the screen next. I'll see you in the next video. Take care. Bye.